This is the Confused Mother podcast, and I'm your host, Gitanjali More. When researching today's episode, I found that there is very patchy research about postpartum depression. It's not talked about, it's barely researched, and there is so much shame and stigma attached to it that most women don't even mention having it. That's why I've invited Rohini Rajeev for a conversation today. We've been colleagues for a couple of years, many, many years ago, and she's also a friend, and we've been following each other's work online. So, Rohini is the best person to talk to about postpartum depression because she is a psychotherapist, she is a clinical social worker, an emotional well being coach, and a healthcare entrepreneur with 21 years of experience in the field of professional mental health care. She's also a certified marriage counselor, a compliance consultant, and a trainer. The Able Mind is her practice. So she works diligently with her partner and team to change the social narrative around mental health, especially in India. And obviously, women's mental health is a big aspect of this, a topic that's really close to her heart, both in her practice and her research. So, Rohini, thanks so much for talking to me today.
You're very welcome, Gitanjali.
It's so nice to see you and hear you, and I'm really looking forward to this conversation. So, I know that I've given a really long introduction to you, but maybe you can also tell us a little bit about yourself, your work, and how you got into it.
Sure. I'd like to start by saying thank you so much for asking me over. And there are a lot of professionals out there. I'm one of them for sure, but not the only one. So it means a lot to me that you reached out. And after so many years, that too, Gitanjali, we haven't seen
Yeah.
each other in so many years. And I really love staying in touch with you. More than, I think it's been what, more than a decade, if
Yeah, I think
I'm
it's about
not wrong.
15
So
years since we last saw each other.
yeah.
Yeah.
Yeah. So it just means a lot to me that, from across the seas, you asked me over for this conversation. And yeah, so I'm excited and I'm looking forward to this because I think awareness is critical to help in any sort of topic,
Definitely.
whatever be the concern that people have. Yeah. About me, yes, your introduction was long enough, I think. But yes, I've been working in the field of mental health for over 21 years. I am a clinician and a coach, psychotherapist. I work with individuals as well as with couples, various age groups, a lot with, women, mothers, single women, and everyone. So, women's mental health, women's quality of life, and how everyday issues tend to creep in on us, and problems get festered because we don't talk about it, we don't handle it, and then finally it just becomes this huge mountain that needs to be
Oh,
crossed,
yeah. I know
and
that.
then we sort of yeah.
Yeah.
So which we are talking about in terms of the stigma associated with
Mm-hmm.
even telling people that I'm having a
Yeah.
problem. So many years down the line, we are still there. Yeah, we've progressed maybe a little bit, which is great, but there's still a long way to go. And podcasts like this, conversations like this, I think will be very useful to open that channel out to people,
I
especially women.
appreciate that.
So that's what you're doing is great, Gitanjali, and I'm really looking forward to contributing there. This is my field. This is my passion.
Yeah, I appreciate
Yeah,
that.
yeah.
Rohini, can you talk to us a little bit about postpartum depression? What is it? How many women face it? And how do you even diagnose postpartum depression?
Okay, so postpartum depression, as you see it, the term depression that is associated with it is a part of your overall, uh, you know, depression diagnosis that is made in the DSM. Which, I mean, if you look at it from a psychiatric point of view, but to talk about it in very simple terms, it is a medical diagnosis. It is an illness. It affects mothers. It affects fathers, young
Really,
parents.
fathers
Oh
as
yes,
well.
fathers as well. While you're saying that
Mm-hmm.
there's very less research on mothers itself, you can imagine how much there would be when it comes to postpartum depression in
Yeah.
fathers. Yeah, so that's a topic for another day.
Mm-hmm.
But it happens to all of us, and there is no age, race, culture, educational qualification, position, money, nothing that makes it any different. So it's a uniting, problem, unfortunately. And we can
Yeah.
tackle it, we can, deal with it together if we know what we're dealing with and how you go about dealing with it, right? So postpartum depression technically comes under the general, depressive disorder, and
Yeah.
it comes under a category of perinatal depression, which means uh, symptoms of depression that happens during pregnancy and post pregnancy. So you have your perinatal depression, which happens when the lady is pregnant, and then you have your postpartum depression, which happens once the child is born, and during the first couple of
Yeah.
weeks, it can go all the way up to like a year as
And
well.
how do you diagnose it, or how can women know whether they have postpartum depression or not? Because I remember when I had my baby, the initial weeks were so overwhelming. You're completely thrown into this new phase of life. You're a mother. You have this tiny creature that's completely dependent on you. You're flooded with emotions, hormones, pain. There's so many things going on. And I also felt for the first few weeks that I would just start crying. I would be completely full of love for this child. But I couldn't explain a lot of the things, a lot of the times that I cried. I had no idea. And I've heard of baby blues and I've heard of postpartum depression. So, what do you think I had? How do you differentiate between having baby blues and actually having postpartum depression?
See, Gitanjali, baby blues are technically what they would call, the moment, childbirth happens in the first 10 days to the first 2 weeks, because of the drastic change in the uh, hormonal levels that, all of us go through.
Yeah,
Because, there's very severe change in the hormonal system during the 9 months. And then as soon as the baby
yeah,
is born, apparently, the hormone levels just drastically drop in the first 3 days postpartum, as in first 3 days after
yeah,
childbirth. So that's too much, right? Too
yeah,
much for us to sort of take in. And this change is big. So, baby blues is a term that's used when you experience sadness, crying. You're exhausted like nobody's business. You're worried whether you will be a good parent. You don't know how to handle when the baby is crying. You get worried if the baby is not latching on. You're hungry, you're
yeah,
sleepless,
yeah.
you're tired. Yes, and bodily changes as well. And suddenly, I mean, those who've experienced both c-section as well as normal childbirth, it is not just exhausting, it's also quite um, while traumatizing may be a negative word, it is, you see blood, you see gore, you see all kinds
Yeah,
of things, and it just hits you. All right. So
yeah,
I
yeah.
think just that which lasts for 10 days to 2 weeks is called baby blues. Baby blues go away, right? They go away on their
Uh-huh.
own.
Yeah, yeah.
You don't need
Mm.
therapy, you don't need medication, you don't need support beyond your spouse and your immediate family members who try to calm you down. And of course, your baby, will take away
Yeah,
your
of
blues
course.
within 10 days to 2 weeks. You just need to give
Yeah.
yourself some time. So, but postpartum depression doesn't go away on its
Mm,
own,
mm.
and it stays for much much longer than 10 days and 2 weeks. The symptoms you feel is a lot more intense,
Okay, okay.
right? So if you're feeling sad, in this you feel like completely drained out and depressed to, severely exhausted to angry to, even very extreme forms of, stress.
Yeah,
Like,
yeah,
for example, I have worked with mothers who, um, you know not just feel guilty about feeling all these things and having no control over their emotions and these extremities that they're imagining, to a point where they consider self harm, they consider harming the baby.
yeah, yeah.
They just do not know how to handle these mixed emotions. And then they start questioning their intent, they start questioning
Mm.
their thoughts, and are they turning evil?
Yeah,
What's going on, and what has this little baby done? And um, unable to come through with any of their responsibilities, things that are expected out of a new mother, like child care, self care, not eating on time, not taking care of oneself, all sorts of variations in mood to very extreme levels.
yeah,
It's not mild, it's going to be severe, and it's long lasting. Yeah, so
Yeah.
that is a big differentiator.
Hmm.
Baby blues do not last beyond a couple of days to a couple of weeks max,
Yeah,
and it
it's
goes
it's
away.
quite sad because I have also heard from a few women that they realized only much later that what they had was actually postpartum depression. For
Yeah.
example, there was one lady, I mean, I'm going to tell you anonymously, but she wrote me
Mm.
a message on my Instagram saying, and I can also quote, she said, I felt like I would never stop crying. It was impossible to feel a connection with my baby. I was angry and resentful about my loneliness, and nobody would understand. And they would just say, get over it. So she also didn't get any support from her family, and she was struggling with all of this all by herself. And it took months for her to actually build a bond with her baby as well. When I think that as a new mother, that's all you want is to, feel like, oh my God, I'm overjoyed to have this baby. But I think it
Yes,
takes
yes.
some time. Also, for me personally, it took a couple of days to even realize that I had a baby. I was just so numb, and I was trying to figure out what had happened. It was such a drastic, dramatic change from, oh my God, my belly is growing and growing, and I can feel this little monster, moving around inside me and kicking me and causing me so much pain in my ribs and whatnot. And then suddenly she's in my arms. So it took, I think, maybe a week to even register what had happened. And if I didn't have support from family, I don't know how I would have done it.
Absolutely, absolutely. So there is one more variant to this, right? So you talk about baby blues, which comes and goes. You seek support from your family, and once the hormones settle down and you get used to the new role, it goes away on its own.
Yeah.
And while postpartum depression doesn't, but statistically also, I think almost 50 to 75% of us, of women who go through pregnancy, even adoptive parents. It's not just biological
Mm.
parents, right?
Yeah.
So anyone who takes care of a child is a parent, right?
Yeah. Of
and
course.
and the responsibilities come with it, the changes that you experience comes with it. So it is fairly common, baby blues.
Yeah.
However, when you look at postpartum depression, the statistic completely drops to like 15% of the population who deal with postpartum depressive symptoms. And there is another very, very difficult, very rare yet plausible, form called postpartum psychosis,
Okay.
which is like a very extreme form of postpartum depression, which leads you into hallucinations. But it's like 1 in 1,000 people get it. It's
Okay.
very, very rare,
Yeah.
but it's very severe, requires immediate medical attention. And so it kind of leads to severity of agitation, severity of feelings, thought disorder, hyperactivity, fast speech, like anything that you can think of in
Yeah.
terms of a psychosis is also possible. Yeah, yeah. Very rare, but
Yeah.
possible.
Yeah. Oh my God,
Yeah.
that sounds
Mm.
scary. I got goosebumps just hearing you talk about it, because
Yes, I know, I
because
know.
there's so little open conversation about it and so little support that women have. And that brings me to my next question, Rohini. How
Yes,
can family
yes,
members, the partner, grandparents, friends of
yes,
the mother, um, help or recognize these symptoms in the mother if she isn't able to do it
yeah.
herself? And how can they also support uh, her in this phase?
See, the most important thing here is kindness, Gitanjali, right?
Yeah.
You want kindness from your spouse, from your parents, from your caregivers, from everyone around you. And if you look at the shift in focus, that's one of the things that I also get to hear from my clients a lot. That till the day the baby is born, the pregnant mother and her glow and her beauty and her everything is very important. She's been overfed
Oh
and,
yeah.
treated like this
Yeah.
queen, and then the baby is born, right? And the moment the
And then
baby
the
is
mother becomes invisible.
Yes, yes, yes. And while it might sound rather trivial or almost, oh my God, how can you be so selfish? I mean, the baby has come, like, how can you want attention on yourself?
Yeah.
That's not really what the mother is meaning, right? What the mother wants is affirmation from the family that we see you, we know what you've gone through, and we
You
respect
did
that.
good.
Yeah, absolutely.
Yeah,
And
yeah,
it's okay to be tired. It's okay to want to sleep. It's okay to
yeah,
want to, pass water, and you're
yeah.
constipated and you're gassy and you're irritable, and
Oh my
you know
God. All of these
yeah,
symptoms and
yeah,
all of these issues that we have.
yeah. It's okay to
Yeah,
want to be in the bathroom and not come and talk to anyone, right?
yeah,
So the
definitely. Yeah.
expectations need to be monitored, if you ask me.
Mm, mm,
Lower down
yeah,
that thing that you talk about. Oh, you're a mother, your baby's born, so you're a mother now, right? So now you
yeah.
suddenly become this supreme caregiver and selfless soul. It doesn't happen like that. It grows on
I
you.
think with the baby, even the mother is born.
Absolutely. And
Because you both have to, like, the baby needs to learn how to be a human in this world, and the mother needs to learn. Yeah,
yes, and it's a scary place,
yeah,
Gitanjali. Scary. Right. So, like I said, kindness and recognizing that the feelings that the mother is experiencing is not just coming from, oh, she's thinking. It's coming because of, it's involuntary. You are
yeah.
experiencing severe hormonal changes. You're experiencing bodily changes. There's pain, there's discomfort, there's no sleep, and as much as possible, support the mother. Try to pitch in terms of giving her an extra hand in, maybe in cleaning the baby
Mm,
or bathing the baby, or
yeah,
getting her to sleep a little bit, when the baby rests, or volunteer support. Encourage the mom to eat, and so everything revolves around kindness, and recognizing that yes, the mother needs support. And if in case you feel that beyond 10 days, beyond 2 weeks, your partner or your
mm,
daughter, your sibling, your friend is going through feelings of sadness and anxiety and fear, and is unable to move on from there, then encourage them to
yeah,
seek medical attention. Speak to the gynecologist, talk to a therapist, because it means that
mm,
it's not going to go away on its own. Yeah, so that really is the primary support that families need to do, and women need to be open to getting that support.
Rohini, is there any, women go to their gynecologist 6 weeks after they have their baby for a checkup to just make sure that
Yeah,
everything is fine. And is there
yeah.
a mental health checkup? Because I live in Germany, and there's nobody asked me about my mental health when I went to the gynecologist. She just asked me, "Oh, do you want a prescription for the pill? Because you should make sure you don't get pregnant now." And that was it. She did like a little bit of a checkup, and she said, "Yeah, everything looks fine. You're healing fine." But nobody asked me if I had any mental health issues.
No, I doubt this is universal, Gitanjali. I've had two children, and while I love my doctors, um, no, it's how are you doing? Yes, yes, seasoned gynecologists do ask you. My gynecologist, my OBGYs did ask me if I was doing
Yeah,
okay, um, but not very specific to are you doing okay emotionally. It
yeah,
was just, it was a statement. And because I am a mental health professional, I'm very tuned into these things. I would tell her that, okay, this is crazy and I feel this
yeah,
way, and
yeah.
then she would tell me that, okay, give it some time and you're going to be all right. But that's not commonplace with those who are not from the
Mm,
field. They do not recognize that maybe they require support. But no, it's not commonplace.
okay.
No, I wish it
Yeah,
was, but it
yeah.
isn't.
Is there anything that you would give your patients or prospective patients, so that you can suggest that people can use to figure out whether they have postpartum depression?
So while there's not like one specific form or anything, there is some research that's gone into it. So there is a scale, there is a self-diagnostic scale called the Edinburgh postpartum depression scale.
Okay.
Yeah, that's what it's called. It can be downloaded online. For research purposes, of course, you need to talk to them. But for a mother, it's easy. I can give you access to it. I can send it across to you, Gitanjali. It's a downloadable PDF document. It's available in English. I have the English and Spanish versions with
Okay.
me. 10 questions, very simple, and the mother can self score as well. And if the score is beyond 12, I think 12 or 13, then it means that you are under a risk for postpartum
You
depression.
should
So
seek
it's a
help.
self diagnostic tool. Yes, it is just to let you know, let your family know that you're not imagining these
Yeah.
things. And this is, like you said, get over it.
Mm.
No, I mean, that's the most common, most insensitive statement that can be
Yeah.
made. And yeah, so this can kind of put, some structure to
Mm,
those
mm.
thoughts and those feelings of helplessness, and you can reach out to a professional after that. So I'll share that link, that PDF with
Yeah,
you.
definitely. We'll add that to the show notes as
Yes.
well, so that it's a free downloadable for anyone and everyone who thinks that they might have postpartum
Yes, because
depression.
we don't even recognize it, like you said, right? I mean, you just wonder what's wrong with you.
And as you said, it's not a diagnosis, it's just a nudge to say, okay, maybe you should think about getting professional help.
Absolutely.
Rohini, I don't want to
Absolutely.
let you
Absolutely.
go without talking about what you let slip initially about fathers having postpartum depression. Can you tell us a little bit about that?
Yeah, so research is ongoing to figure out, do only mothers have postpartum depression? Is there a concept of
Okay.
postpartum depression in men? And it's like I told you in the beginning, it is an episode of a major depressive disorder, right? So
Yeah.
it happens either during pregnancy or immediately after the birth of the child, and it continues for a considerable period of time. There are certain risk factors associated with postpartum depression. If you are interested in that, we can talk about that. But now that you're asking, about men,
Yeah.
fathers, uh, yes, while the intensity may not be the same as a pregnant mother, fathers are also, studies are saying that fathers also go through hormonal changes, and there are risk factors associated with PPD in men, including a previous history of any sort of mental illness. Uh,
Okay.
and yes, and not being ready for the baby, problems with the wife, people who have marital discord, people who have financial reasons. Like, for example, we have the baby now, but I don't know how I'm going to take care of the baby. And, so there are very
Yeah.
certain issues that come up there. Then, of course, sleep deprivation, your circadian rhythm goes for a toss. You don't know what is day, what is night. And
Yeah.
of course, if you don't pitch in, then your wife begins to um, you know tell you about, oh, I mean, what are you talking about, sleeplessness, and it's nothing
Mm.
compared to what I'm going through.
Yeah.
So the feelings of inadequacy that comes in with the fathers, because they, like, they are doing what they can, and the fights that happen with the partner, and
Yeah.
so, of course, along with other comorbid reasons.
Yeah.
So
Yeah.
it brings about anxiety in men. It brings about,
Mm.
incidents of, severe depression. So I've had cases where the couple has come to me, and both of them talk about the same feelings, harming the child. And they
Yeah.
were trying to convince me that, isn't it normal? I mean, I as scary and disturbing as it might sound,
Yeah.
it happens, right? The child is crying continuously. The child is colicky, and unhappy and cranky, and they have a 2-year-old as well. And so this couple that
Yeah.
came to me, was they were going crazy. So they were like,
Yeah. Yeah.
ma'am, is it okay to tell you this, but we really sometimes hate the baby,
Yeah.
right? And we want to, thoughts of hurting the baby. So, they're trying to
Yeah.
convince me that they're not, like, going through lunacy, and I hoping that I would understand, because they tried to tell their parents that, and the parents were horrified, right?
Of course, yeah, because that's not the normal reaction you would
Absolutely.
expect from parents, yeah. But I think that what you're saying, this combination of so many factors, sleeplessness, the baby is unhappy, then I think also when babies cry, they really trigger something in you, and you
Yeah.
do everything in your power to make it stop, to make them stop crying, and I think um, that's where these thoughts of harming the baby come from. I think is that you're like,
Or
why won't
harming
the baby
yourself.
stop, or
Yeah.
yourself?
Yeah.
Yeah,
Yeah.
yeah. And yeah, it's quite a dramatic situation, or it can
And
get
the
quite
guilt
dramatic.
after that, right? So when the couple
Yeah,
came to me, they wanted to handle that guilt of thinking this way. They're like, how can we think something like this about our baby?
yeah,
We love him so much, right?
yeah.
Like, what
Yeah.
kind of devil thoughts are these? And
Oh no. Yeah,
like, devilish. And I'm like, yeah, it's okay, right? It
yeah.
happens.
Mm,
Self
yeah.
compassion is really important in this period.
At least they came to you. So that's a big relief
Yeah.
that they came to you. They realized that they needed to get help and they got the help from you.
No, but again, Gitanji, they didn't come because they thought it's postpartum depression. They came to me for a couple counseling session. They came to
Ah,
me saying their
okay.
marriage is falling apart. And they
Okay.
came with a 6 month old and a 2 year old.
Yeah.
So, it took them some time to figure out that, oh my God, this is the reason, right? We're
Yeah.
like, oh my
Yeah.
God.
I've actually heard this. Like, if you're happily married, don't have kids. Someone has actually said that because kids really try, they really test your relationship. That's for sure.
They
Yeah.
do, they do. But for no
Um,
fault of theirs.
no, none whatsoever.
Yeah,
it
yeah.
just, it just, it just happens that way.
No, we're not prepared for it, no, Gitanji. We're not prepared to be parents.
No, no, and I think no matter how many, like, no number of books that you read, and no amount of kids that you've already, hung out with, played with, and so on, will prepare you for this journey because it's the most different thing that you've ever done in your life. At least for me, in my case, that is
And I
definitely the
remember
case.
reading from one of your blog posts, or I don't remember what post, Instagram post, I think, where you wrote that, when Liliana was crying through the night, you and your husband stayed up together wondering
Yeah.
what to do. And the underlining point was you did it together, which is the
Yeah.
most important thing.
Yeah, definitely. Yeah, that's true. I now it's now that you remind me, we had that. We just laughed in the end because at some point that's all you can do. You just have to laugh because of how ridiculous the situation is.
Yeah, but that would have
And
brought you guys together. But what
definitely it
happens
did.
is, a lot of couples fall apart when this
Yeah,
happens.
yeah.
Why don't you take
That's
care of the
true.
baby?
So are there any risk factors? Like you mentioned risk factors. Can you talk very briefly about that?
Yes, yes. So again, research-based risk factors, people with existing mental health issues, people with a history of
Yeah.
mental health issues, people with a family history of mental health issues tend to have, a possibility of
Mm,
developing
mm.
postpartum depression. And people who already had, like, for example, if you've had postpartum depression during the first childbirth, the chances of you having it again for subsequent children increases by
Oh, yeah.
30%,
Okay.
apparently. Yeah, so those
Yeah.
are risk factors, which means that you should, if you've had any sort of depressive episode before, be prepared to sort of get your support system in place during the phase and
Yeah.
post the phase as well, so that you're able to handle it better.
Okay, yeah, good to
Yeah.
know. Rohini, one last question.
Mm.
If you have one piece of advice for all the confused mothers out there, what would it be?
You're new to this, so seek out support. This is not the time to be egoistic and, um, you know, treat yourself as a superwoman or go by all the social media posts about how people do it all, you know, because no, you don't do it
Yeah.
all. You are able to do it because you have a supportive partner, you have a nanny, you have, your parents, your
Yeah.
in-laws, you have this whole village that is helping you to raise it. And it's okay to say that, okay, I am tired and I'm really not able to handle this. So seek out for
Yeah.
help, even if it means asking for something to eat, even if it means handing the baby over to one person who's offering to take care of the baby.
Yeah.
There are some of us who are very particular that, oh no, my
Yeah.
baby has to be raised this way, my baby has to sleep at this time and feed at this time, and it has to be a schedule there, and that cannot be done if somebody
Oh
else is
my
doing
God.
it.
Yeah.
Hands off for a little bit is all right. It's fine. You really need to prioritize yourself if you need to take care of
That's
another
also
person.
fine. Yeah. Yeah. And also yourself, like taking care of yourself.
Yes, yes, you have to take
Yeah.
care of yourself, which is what I meant when I said
Yeah.
prioritize, because
Yeah.
there isn't anyone who can do that for you. Nobody. Got to do
Yeah,
it
that's
yourself.
for sure. I remember when figuring out how we are going to manage, with the newborn baby in our apartment and everything. I called
Yeah,
up my mom and I said, "Please come to Germany.
yeah,
I need your help."
yeah.
And they are not really young anymore and they're not super fit, but they just came and they stayed with me for 2 months, and it was so helpful. They took over, all the cooking, the shopping, the cleaning.
Exactly.
They got also, obviously, they got time with me, with my husband, and obviously with their grandchild as well, and it was a great, very beneficial um, situation for all of us to be in, and to kind of support and lean on each other. And I am forever grateful to my parents for that, and
Absolutely.
yeah, for making that journey. So in that moment, I was kind of, shameless, so to speak, because I just said, "Listen, I need you. Please come."
No, there is
And
no
they
shame,
came.
Gitanjali. There is no shame.
Yeah, because they're my parents. So yeah,
Please, we do that even now. I'm like,
yeah,
because I know that it's not about asking them to do childcare, right? It's about acknowledging the fact that they come with experience, they come with expertise, they come with the intent to support you, their child.
yeah,
And
exactly.
sometimes that's enough.
It's
You know,
more
that
than
gives
enough.
us a
Yeah,
certain drive to sort of be
yeah.
okay.
Rohini, thank you so much for taking time to speak to me today. It was a pleasure.
You're very welcome.
If you liked this interview, why not subscribe to my channel? Share the story with anyone you think might be interested in it. To support my work, you can do so for just the price of a coffee. You can find the information in the show notes. Thank you.